This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine your blood vessels and heart are like a city's plumbing system. The heart is the main pump, pushing water, blood, through all the pipes. But sometimes, if the pump gets tired or weak, the water starts backing up. Instead of moving smoothly, extra fluid gets squeezed out of the pipes and starts flooding the surrounding area, especially the lungs. When the lungs get soggy and full of fluid, it becomes incredibly hard to breathe. In emergency medicine, we call this a congestive heart failure flare-up. This is where furosemide comes in. You can think of furosemide as the emergency plumbing team's super drain. Here is exactly how it works when someone is having a heart emergency. The eviction notice. Furosemide rushes straight to the kidneys, the body's water treatment plant, and tells them to instantly start pulling huge amounts of extra water and salt out of the blood. The big drain, the kidneys turn that extra fluid into urine. Within minutes, the patient needs to pee a lot, relieving the pressure. By draining all that extra water out of the body, the total amount of fluid in the plumbing system drops. This gives the tired heart a massive break because it doesn't have to push against so much heavy fluid anymore. Clearing the lungs. As the pressure drops, the fluid that was flooding the lungs gets sucked back into the pipes and drained away. Suddenly, the patient can take a deep, clear breath again. In the back of an ambulance or in an emergency room, it is a fast-acting tool used to quickly dry out the lungs and let a struggling heart catch its breath. When a 911 call comes in for someone struggling to breathe, paramedics have to act fast to figure out if the problem is a fluid backup issue where furosemide could help, or something completely different, like an asthma attack or pneumonia. Because furosemide drains a massive amount of fluid out of the bloodstream, giving it to the wrong patient could dangerously dehydrate them. Paramedics look for a specific cluster of clues during their assessment to confirm the heart is failing to pump effectively. Here is how paramedics piece the puzzle together in the field. 1. The interview. History of present illness. Before even touching the patient, paramedics gather rapid clues from what they see and hear. The position. Patients with fluid backing up in their lungs almost never lie flat. They will be sitting bolt upright, often leaning forward in a tripod position because lying down feels like drowning. The story. Paramedics ask if the patient woke up suddenly gasping for air, paroxysmal nocturnal dyspnea, or if they have noticed their legs swelling up over the past few days. Medical history. They check if the patient has a history of congestive heart failure, CHF, past heart attacks, or high blood pressure. 2. The physical exams. Next, paramedics use their senses to find physical proof of fluid overload. Listening to the lungs. Using a stethoscope, they listen to the breath sounds. If fluid has leaked into the air sacs, they will hear a distinct popping, bubbling, or crackling sound at the bottom of the lungs, known as rowels or crackles. Checking the neck veins. They look at the jugular veins in the neck. If the heart pump is failing and blood is backing up, these veins will bulge out like taut ropes, jugular venous distension or JVD. Checking the legs. They press a finger into the patient's ankles or shins. If a dimple stays there like dough, pitting edema, it means gravity has pulled the extra fluid down into the lower body. 3. Vital signs and technology. Paramedics use advanced tools in the ambulance to back up what they are seeing. Blood pressure. In acute heart failure flare-ups, often called flash pulmonary edema, the blood pressure is usually sky-high. Paramedics must ensure the blood pressure is stable or elevated before giving furosemide. If the blood pressure is already low, draining fluid could cause it to crash dangerously. Oxygen levels. A pulse oximeter will show very low oxygen levels because the fluid in the lungs is blocking oxygen from getting into the blood. Cardiac monitor, 12-lead ECG. They take a snapshot of the heart's electrical activity to see if an active heart attack is what caused the pump to start failing in the first place. Capnography, waveform EtCO2. This tool measures exhaled carbon dioxide. It helps paramedics immediately differentiate between a heart issue, which usually shows a crisp, square wave, and an asthma/COPD issue, which shows a sloped shark fin wave. The verdict. If a paramedic finds a patient who is struggling to breathe, sitting upright, has crackles in their lungs, bulging neck veins, high blood pressure, and a history of heart failure, the puzzle is complete. They know the plumbing system is backed up, and they will clear the lines by administering the furosemide.